Hey, good morning. This is Steve Stites, Chief Medical Officer here at the University of Kansas Health System, broadcasting live with you from the Dolph Simons Jr. Family Broadcast Studio here at the hospital. Lance Williamson is in the house to help answer questions this morning. Lance is our Infection Prevention and Control Nurse Supervisor. We've also got a very special guest joining us from Jefferson City on the Missouri side. 12-year-old Max has a great story to share, and he's here with his mom and his dad. We'll hear from them in just a moment, but first, Dr. Leonard McCoy, Bones McCoy, no, wait, sorry, wrong show. Dr. Dana Hawkinson, Medical Director of Infection Prevention Control, joins us from the road with our numbers. Yeah. How do we look going into the weekend there, Doc Hawk?
You know, we're doing pretty good. Hayes is doing well, one inpatient. We here at the health system, our numbers have gone down a little bit, which is really encouraging. 9 active patients, 2 in the ICU, 1 on the ventilator, and we also have 9 additional in that recovery period, so 18 total patients, 9 active, 9 in recovery. And just going through a little bit of those numbers that Lance was able to disseminate out, we do have one of those patients in the ICU is vaccinated, and that is a patient in their 60s. All the other patients that we have that are active and they are symptomatic are all unvaccinated. We have 3 patients in their 60s, 1 patient in their 80s, 1 patient in their 40s, 2 patients in their 30s, and 2 patients in their 20s. And one of those patients that's in their 20s is in the ICU. But again, all of those except a patient in their 60s is unvaccinated. So I think that's important to note. And that is the numbers that we're seeing around the nation as well. There was a recent U.S. News and World Report publication that said that only about 150 of the 18,000 deaths in the month of May were due to vaccinated patients. So the vast majority of these patients that are having severe and critical disease and death are unvaccinated.
Yeah, and I think you meant the deaths were in patients with coronavirus who had been vaccinated, not due to the vaccination, obviously. Yeah. And I think the other important point is that the people who are sick and are vaccinated are the very ones we're not sure how good their immune response is overall. Really good discussion in the New England Journal of Medicine. Again, New England Journal of Medicine is by subscription, except I think their COVID stuff's all still free. And so they had these audio discussions. I listened to it this morning. Just came out yesterday, and talking about the efficacy of vaccination and should you get a third dose in people who are immunocompromised. In this case, it was transplant patients. But somebody who's getting chemotherapy has been vaccinated and then gets COVID-19 and gets really sick. I'm not sure the vaccine was going to help much because you have active chemotherapy. Hawkeye, what do you think?
Yeah, absolutely. You know, anything we can do to boost the immune response. One of our transplant physicians, Dr. Jeffrey Klein, was really big and really intense and really cared about his patients. And this was a huge question for him. So I think this is one step closer to getting that answer, not only in solid organ transplant patients, but all of the patients that are immune compromised. And I have to say, Steve, you know, I've just learned last night of a couple of our colleagues that have gotten actually more than 1 dose of a vaccine, more than 2 doses. This is because they were in trials when the trials started, but then they also went ahead and got regular vaccines that were approved that they were able to get at the health system. So speaking to the safety, we know these vaccines are safe. And so I think that continued hesitancy and argument about the vaccines not being safe or concern about the safety, you know, again, I think that is a very minimal argument or concern at this point in time.
Yeah, I think that is exactly right. Now, I know we have a lot of questions today, but before we get there, first, Hawkeye, I just want to say thanks to Lance for coming down and being your sub. Lance, you look beautifully dressed today. You look great. And I've got this wonderful tie on. Hawkeye, how are you dressed today? Let's take a look.
I'm just representing the Jayhawks, man.
Yeah. Are you going to stand up or are you just going to sit down? A quick stand. A quick stand. Come on, brother.
No.
Come on, brother. So just to be nice to Hawkeye for a minute, Hawkeye is at 6 a.m. He's on vacation, and I'm giving him a hard time, which means this is a very good day. This is just a great Friday, and we're all having fun. Go ahead. I'm watching you. I'm waiting for you. Come on.
It was a gift. I got my Jayhawk flannels.
Yeah, that's what I'm talking about right there. It reminds me of that song. How's that go from Hamilton? Who sits, I something about stand, sit, stand. Kind of funny. There may be some not so good words in there. I don't know. So, all right. Well,
a silver lining of COVID is working from home.
That's it. That's exactly right. And sometimes we dress up on top, and sometimes that's the only place we've really dressed up on, right? There you go. I like it. I do want to say thanks for joining us. So it is pretty cool you're doing it from the road. You're a better man than I am. So
that might possibly just be a little bit of TMI on a Friday.
No. It's all good. It's all good here. I've made my Star Trek reference. We're having a little bit of fun. Lance is in the house. We're good. Hey, let's first of all see if there are any reporter questions out there this morning. Not hearing any. All right, that means we get to jump right into our discussion. But before we do that, I just want to say a special thank you to everybody out there who sends in these questions, Jill.
Yes. I think we want to talk to our guests.
We do want to talk to our guests. Thank you for saying that. Oh, my gosh, I did skip that part of the script. Max, don't let me do that. A big welcome to Max, his mom, Laura, and his dad, Guy. First, Max, happy belated birthday. When was your birthday?
It was June 21st on Monday.
Excellent. And listen, Max, what did you get for your birthday?
I got the vaccine, then I also got a kayak and a phone case.
Ooh, that is awesome. What was the best part of the birthday, though? Kayak, vaccination?
Everything, honestly.
Yeah, that's a hard question to answer. Well, thank you for getting that COVID-19 shot. Why did you get a COVID-19 shot, Max?
So I could help myself and others be safe and try to slow the spread of COVID.
I love it. That is awesome. How are you feeling afterwards?
I'm feeling great. My arm hurt a little bit after, but it didn't keep me from anything.
That is really good. Well done, Max. And can I just say, I'm going to spare you for my singing happy birthday. It's kind of like happy birthday to you, happy birthday, dear Max, happy birthday, dear Max. Happy birthday. I even sang it wrong. There you go. So, Mom and Dad, why did you as a parent want Max to have that shot?
I think, we were both vaccinated back in March, and we understand the importance of it. We are very blessed and lucky to have family and friends that are physicians and doctors that gave us great advice on giving the vaccination to ourselves and our kids.
Well, you did the right thing. I'm very biased here. You did the right thing. And Max, you did the right thing. And you're right about that vaccinating, helping yourself and helping others. Now, Max, I'm going to do a very careful thing here because I went to the University of Missouri, Columbia for medical school. I believe that's exactly about 35 miles north of Jeff City, right along Highway 63. Now a beautiful dual-lane highway. It wasn't always that way when I was growing up as a kid. But I'm going to say something. I'm going to make sure you can pick up and you work with me on it. You ready? M-I-Z, Max.
Oh, Z-O-U.
Say it a little more clearly. Say it with some conviction, brother. M-I-Z.
Conviction.
Oh. M-I-Z-Z-O-U.
Well done. That's what I'm talking about. We can do a little black and gold love on this show. You know, one of the things is after you've been at KU for 31 years, you can be what I call a Tiger Hawk. You can cheer for both Mizzou and KU. Not like Hawkeye, who has to only talk about the Jayhawks all the time. That's what I'm saying. You know what I mean? So seriously, are you a Mizzou fan, Max?
Yes.
Okay. Do you ever go up to any football games?
No.
Yeah, they're kind of fun.
Yeah,
Yeah, they're kind of fun. Unlike the KU football games, they're not as much fun. But in fairness, KU basketball is an awful lot of fun. So, listen, Max, it's great to have you on the program. What message do you want to give to all the other 12-year-old, all your friends, all the family? What message do you want to give them?
Get the vaccine and just help everybody out and try to slow it down, and it just doesn't really hurt that bad. And once you get it done, you realize that wasn't much of anything, and you helped a lot of people out.
You do help a lot of people out. That is perfect.
You might ask him about his older sister.
Ooh, I'm supposed to ask about your older sister. Talk to me about that.
She's, I think, getting it soon.
Claire will be getting her vaccine this afternoon. However, she was a little hesitant on it because she is in the at-risk population because she has severe allergies and asthma. And so it took a little hesitation on her part to be ready for taking that big step for the vaccine. However, she has decided it's time. So she'll go this afternoon to do her
Well
part.
done. And her name is Claire, is that right?
Yes.
Well done, Claire. We just make a special shout out to her for making that choice. Hawkeye.
Yeah, I'd just like to say, I think vaccination for birthdays is great. I can't wait until I'm 50. I'm going to get the shingles vaccine as soon as I can.
Oh,
And
yeah,
I think
whatever.
everybody, should get themselves and their children vaccinated. It's a great birthday present. But you being in Jefferson City, I was recently on some text communication with one of my colleagues there in Springfield, actually. But things are dire there. At least 100 inpatients. And his main message was, as we have already talked about, the real only person he's really seen in the hospital with COVID pneumonia is one vaccinated person compared to the rest. 99% of those people that are coming to the hospital are unvaccinated.
And just to say to all those people out there with a chronic disease like asthma, where you may have some allergy history, and then you get COVID-19, wow, COVID-19 may be far worse for you than a vaccination. There are things we can do to treat the immediate response to a vaccination if you have any trouble. We don't really lose people from that with a vaccination, even those who have severe asthma. But people with severe asthma, that can be a rough, bumpy road if you get COVID-19. And with the Delta variant out there, and very profound in many parts of Missouri, especially around the Springfield area by report, then we get really nervous about people getting COVID-19 and being unvaccinated. So hats off to the family here. You guys are doing a great job. Thanks for being on that program today. We're going to, if you hang out with us, we're going to switch and hear some questions and try and roll through these questions.
Yeah, and we have some questions coming in. I'm going to do the printed ones first, and then we'll get to these others. And some of them do have questions about kids getting vaccines. So first question, do the mRNA vaccines, Pfizer and Moderna, and or J&J vaccines protect against the Delta variant? And which one works the best?
I think it's actually pretty clear that these vaccines do all work against the Delta variant. They may not have quite as high of efficacy as they do against the more common variants of the initial ones, but the Delta variant is still very effective. I don't know, Hawk, that there's really enough knowledge yet to know which one is the most effective. I think the answer is they're all pretty darn effective here.
Yeah, they are all very effective. We don't have a lot of information about the J&J vaccine, but I was watching a lecture by Dr. Anthony Fauci last night, and anybody can get this lecture if they go to the New England Journal of Medicine website. There is a lecture about halfway down on the website that anybody can view, which I would really encourage people to do that. One of his slides that they had is about a month ago in late May, the Public Health Service in England actually had a press release which did show that 2 weeks after the second dose of the Pfizer vaccine, it was 88% effective against symptomatic disease from that Delta variant. So we have very good information there. More will come out, but those are some hard numbers still showing that there is really, really good efficacy protecting against symptomatic disease, even to the Delta variant with these vaccines.
Yeah, again, so important. Vaccines work, and they work really well. Jill.
If I had COVID-19 in the past, am I protected against the Delta variant? And as if I recall right, this person wanted to know, I don't really need a shot, right? Because I had COVID.
Yeah, I think the problem is, the durability of your infection, though it does appear to be pretty good. Let's be honest, there's some recent evidence coming out that suggests there's pretty good durability of having had COVID-19 for how well your host immunity stays up. Not as good as the vaccination, by the way, but it does appear to stay up. The question, though, is that immunity, if you didn't have the Delta variant the first time, probably isn't as good as vaccination is against the Delta variant, and that you're probably more susceptible. Actually, another reason to get the shot, Hawkeye.
Yeah, nothing to add there. You're exactly right. The guidance is, even if you had it in the past, get vaccinated. And I truly believe, and just as you said, your immune response to the Delta variant is going to be much less if you had that natural infection, especially probably before the beginning of the year or before the Delta variant became prevalent, compared to vaccination, where we have really good data to support the efficacy of vaccination against the Delta variant.
Exactly.
This next question, I think Dr. Hawkinson kind of alluded to, but Lance might be able to help too. How many people hospitalized in Springfield, Missouri are vaccinated, and why don't they report that daily? I know here, Lance, you have to pull that manually, right?
Yeah, we started to do that manual process recently so that we can share that information with the public, and especially because it's so clear that our hospitalized patients are pretty much all unvaccinated, and it aligns with the numbers we're seeing in the clinical studies and the information we have for the vaccines and their efficacy. So we wanted to share that, and I think that's something that hospitals will probably start doing more and more as we go on. But as far as Springfield, I'm not sure exactly what.
Yeah, I've not seen that data, and I don't think they said it. Have you heard that from your buddy, Hawk?
Yeah, sounds like he's extremely overwhelmed. He is getting 5 to 8 consults a day to go see these patients for those medicines that we reserve for the most critically ill, and those is like the tocilizumab that we've heard about. So, he's overwhelmed. We know that their hospital capacity is overwhelmed. We know that when you have COVID and COVID pneumonia, one of the primary caregivers to you or your family is respiratory therapists helping with oxygen and breathing treatments. Well, they're running about 50% capacity of the amount of workforce for those respiratory therapists. So I think it is very dire in Springfield. Again, a quick answer to that. Over the last few weeks, he has only seen one vaccinated person with COVID pneumonia. All the rest have been fully unvaccinated. And I think we can actually try to get him on the program here in the next week or so.
Oh, that would be so awesome to be able to talk to him directly. Yeah. But the message is still the same. People who are vaccinated are much safer than those who are not. That's a lot of much.
Does long COVID have any adverse effects on a person's thyroid?
Gosh, guys, I've not heard of that. Lance, you, Hawk, has anybody heard about the thyroid and long COVID?
No.
Don't know. Not hearing it. We'll have to look it up.
Yeah, people have been.
I have done a couple lectures on it and looking through the research papers. I've not really ever seen any role in thyroid disease for that. Obviously with COVID, we're not going to say it can happen, but if it does, it is going to be a very, very small percentage of patients that have had issues. But again, it's one thing that we are continuing to research.
Did lack of taking the COVID-19 virus seriously allow for the stronger Delta variant to exist? And if more people fail to get vaccinated, will an even stronger variant appear? When does this end?
Hawkeye, here's what we know. If we can get people vaccinated, we know viral replication doesn't happen nearly as frequently, and we know that mutations happen when the virus reproduces inside our body. That's when we get into trouble. So I think the answer to this question is really clear. Not taking it seriously by not wearing masks and not following the rules of infection control absolutely contributed to the widespread development of COVID-19, absolutely contributed to the fact that more mutations can appear. But remember, this is not a virus that respects a national, a state, a local border. So until we get the whole world vaccinated, right, we can still see more mutations. Our struggle is that the more people who have COVID at any one time, the more likely they are to develop, or we are all to see the rise of another mutation. So the real answer to this question is not only do we need to get vaccinated in the United States, we're going to vaccinate the entire world. That's how we find safety. Otherwise, what we're going to do is keep finding more variants, Hawk.
Yeah, exactly. The question's it's a little bit difficult. Now, certainly there were major pitfalls and caveats to the American response to the pandemic, but we also do understand what was going on around the world before vaccination. You had a lot of widespread infections, prevalence. We know that some of these variants and some of these mutations arise separately in different parts of the world. So it's not just India or the UK or South Africa, but we've seen some of these types of variants and mutations arise in other parts of the world independently. So it's not just a matter of that, but to your point, the way through this and to protect people is for vaccination. And I think stronger is probably not the word we would use. I think an overall a better language would be more fit. how is it more fit? Is it able to replicate more so you have more copies of virus that you're expressing into the environment? Is it more fit because it binds more tighter to your receptor? Or is it more fit because you can shed it for longer periods of time than we normally think for this virus? Or does it also reduce our immune response after that initial infection? So there are various ways to try and understand and tease out what exactly makes this variant different from other variants, more dangerous, does it cause more severe disease, things like that.
Yeah, so important. It's a lot of science wrapped up into this question. But what we know is this: the way to keep us safe is to reduce transmission. The way to reduce transmission and therefore more mutations is to get vaccinated. And if you're not vaccinated, wear a mask. And even if you're vaccinated and you're nervous, wear a mask.
With the Delta variant in Missouri, is it safe to go to the Chiefs training camp up in St. Joseph and attend 4th of July
What do you think, Lance? What do you think?
Again, I think it's it's important for us to consider that there is a big population of our U.S. residents who are not vaccinated, not eligible for vaccines, and that's children. So, that's something that I think we should not forget about as far as like their risk. So that under 12 years old, and I think it's like we've said before on this show, it's a assessment of your individual risk, but knowing that those large groups together, that will increase the relative risk of whatever you're doing. And so I would look at is there masking? Is it outside, which we know is a bit safer than inside? So those kind of behaviors, I think, are going to be really important for us to consider in events like this.
Here's what I would say. You can be safe and go to the Chiefs camp if you're vaccinated. It's a clue card, folks. VAX, vax means vaccinated. And it really, man, gosh, it just makes all the difference, Hawkeye. If you're vaccinated, inside, outside, every side, man, get vaccinated. You can be safe. You know what I love? I'm watching Max in this video right now. We can see him. And Max, here's what I know. You're running the tech at your house, which is just like my house. Now, my kids aren't 12 anymore. My youngest is 25. My son is 25. But when I have trouble, I say, hey, James, what are you doing? You got to come help me out here, brother. And then all of a sudden, my tech works. In the meantime, my tech doesn't always work. And so I love watching that happen because I watched Max is like, okay, Dad, let me fix the tech. I can fix this for him. And then it comes back. Hawkeye, outside, inside, Chiefs training camp. What do you think? By the way, I would love to go. I plan to go. I hope to go. Yeah,
It's outside, and I think that greatly reduces any risk. And if you can stay a little bit distance from other people, that's great. Enjoy.
Yeah, my final answer to this question is keep Patrick safe, keep Andy safe, keep Travis safe, keep Chris safe, keep keep Tyrone safe, keep the whole team. Get vaccinated, and if you're not, wear your mask. Next question.
All right, should vaccinated people be concerned about attending football games this fall? Will we need to mask then?
No, I don't think so.
Yes. I love Lance could come back anytime. But only if what, Lance?
If you're vaccinated.
If you're vaccinated. Yeah. If you're not vaccinated, is going to the football game safe?
Yeah, probably not.
Not as safe. I mean, granted, almost all infections occur inside, not outside. So you're probably, but yeah. Arrowhead Stadium with people shouting at each other, sitting right next to each other, and right on top of it, and maybe having had a little bit to drink. That never happens at Arrowhead. But people being a little wild and crazy at the football games. I'm just saying, I'm not sure that's the normal outside. Hawkeye, what do you think?
Yeah, interestingly, in that Dr. Fauci lecture that I listened to last night, he was asked that question, but not just about that, but just about doing things. And his answer was, if you are vaccinated, you are going to be safe from symptomatic disease from COVID-19. What it boils down to is your individual assessment and how much can you tolerate the risk. And so I think that boils down to every individual person and their friends and their family of what do they want to do. And if you are ever feeling unsafe, then certainly use those non-pharmaceutical interventions, the masking, the distancing, but just really assess what are you going to be doing and what is your tolerance for that risk.
So, Max, do you like to play sports?
Yes, I play traveling soccer.
Traveling soccer, so that means you're really good.
Yeah.
Yep. If you're a traveler, you do. And you're good on tech, too. I've watched that. So, Max, do you feel better that your parents I take it they go and watch some of your soccer games?
Yes, they do.
And I bet you're do you feel better that they've been vaccinated when they go to watch those games or around others?
Yes, I do.
Yeah, awesome. And Max, I bet you feel safer because you didn't want to bring a virus home to your sister with asthma.
Yep, I didn't.
That's a good reason to get vaccinated right there. You've made all the right choices, including how to run tech. Okay, let's go, Joe.
I really like Max.
I like Max, too.
He's a good boy.
He's a good guy, and he's a Tiger. We like that.
Yeah.
And by the way, is that your favorite college team? I kind of walked into that just because you're in Jeff City, but is that your favorite college team, the Tigers?
Yeah, probably.
Probably. Who else do you like, Max?
I don't really watch much like college sports, but yeah,
Okay.
I don't really watch many college sports.
Yeah, it's because you're out playing
Oh,
travel
yeah,
and soccer.
Yeah, my favorite soccer team is the KC Sporting.
Awesome. And who's your favorite pro team?
Probably
Football.
Man City.
Okay, soccer, I got it. Yeah, man. What about in football? Who's your favorite pro team?
The Chiefs.
Okay, now here comes the question that's going to determine if you can ever come back to the show. Who's your favorite baseball team, Max?
What?
Who's your favorite baseball team?
Oh no.
You're a Cardinals fan. It's okay. It's okay. You're a guy. Listen, my med school roommate Mark Peacock was a really very good friend of mine, and he was a Cardinals fan, and I was a Royals fan during the 1985 World Series, and we couldn't watch the games together. It was tough. He didn't speak to me for a week after Don Deckinger made the right call at first base.
Why did the CDC have people stop wearing masks and everything to open up? It just feels like a bad call.
Lance, was that a bad call?
Yeah, this is a contentious subject in the arena of public health. And I think it's important to remember that the CDC generates guidelines and recommendations that are based in science and evidence for governments and states to interpret and implement. And so, it's not just the CDC that's, making mask restrictions. So I think that, and there's local reasons why a state would change their mask requirements based off of their local economy or things like that. So I think that this is a pretty complex situation, and the CDC, they were wanting to make sure that if you're vaccinated, you do have the ability to take the mask off and participate in society a little bit differently than others. So that was part of that recommendation, but it is between the states on deciding on what is opening up for them.
Yeah. Hawkeye, what do you think about CDC and the whole thing?
Yeah, I think the key point to remember there is their masking guidance was based on if you were fully vaccinated. And that's what that was. And it's purely public health and individual health guidance. Now, when different communities, whether it's state, county, city, communities are making those decisions, it's not just about the medical. Unfortunately, there are other things that you have to take into account. Economics is a major one as well. But I think the original question, we have to go back to the CDC made guidance for those that are fully vaccinated.
Yep. And here's what I would also say. When the CDC is a public health agency, and public health is, first of all, it's clearly COVID-19, but public health is also depression, anxiety, suicide. Are you safe at home? And what's right for our overall national health and even the national economy? So I think what the CDC really said is, look, there's evidence that shows that if you're vaccinated, you're safe, and we want to reopen up our society, and that's going to make people better in so many ways, including mental health. But if you're not vaccinated, you should have to follow the same rules. Now, granted, that comes down to individual personal responsibility. But I don't really believe that the CDC's statement that we're going to make this change really affected the behavior of those who don't wear masks. Because I think most of the folks who don't wear masks weren't going to change what they're going to do, whether or not the CDC said what to do. But what the CDC did do is to give permission and a vote of confidence in vaccination to let us get back out and help us reopen society. and in doing so, improve our mental health, which I do think has gotten better since people started getting vaccinated and the numbers have kept falling. And that's the other thing, is the CDC is watching the numbers fall and watching the numbers really go to ground in those who got vaccinated. So I think they made the right call. Now, I have the benefit of looking backwards to say that, and it's always easier when you get to look backwards than forwards. But, I think they tried to take the whole public health in mind. And I think they believed that those who were not going to wear a mask and were not going to get vaccinated were going to really change their behavior from that ruling. Just my thought.
Do you know how much natural immunity is reduced when on chemotherapy to fight cancer, and how effective the vaccine might be?
Yeah, this is one of those really broad questions, Hawkeye. I'm not sure there's actually really an answer to this question because it's a quantitative question. How much is it going to be reduced on chemotherapy? Yeah. It depends on your chemotherapy. It depends on your level of immunosuppression. Yep. It depends on how long it's been since you got vaccinated. I mean, there's so many variables in this question, it's really hard to answer. What we can tell you is that directionally, that if you have been vaccinated a good 6 weeks prior to getting chemotherapy, that's probably better than trying to be vaccinated while you're getting chemotherapy. Yeah. And that clearly the more immunosuppressed, the more the chemotherapy is aimed at trying to suppress your bone marrow, the more likely you are, vaccinated or not, to be susceptible to COVID-19. One of our admissions in the vaccinated population was someone on active chemotherapy. So how much it is and the exact amount, difficult to say. Here's what we do know. If you've had chemotherapy and been vaccinated, wear a mask. Just wear a mask. Because as we've proven, Lance, how many patients or how many staff have been infected at KU working with our COVID-19 patients when they had a mask on? Zero people. Masks still work. And even if you've had chemotherapy, masks work. So the answer to this question really is wear a mask. Hawk, anything different?
Nothing to add, no. Exactly.
Okay. Jill?
Okay, so I have one more pretty question, but I have several here. Are you going to let me ask those?
Yes, ma'am. Let's go.
Okay. So I have to be polite and ask now.
Oh, no, she doesn't. Yeah, see what she does after the show, people.
Well, when the cameras are on, I got to be. So, yeah. All right. So what percentage of the adult population has had 2 shots? Do you need to be fully vaccinated to protect against and not spread the Delta variant?
Let's take on the second part of that question, Hawkeye. I'll look it up. I've got the New York Times map right here. We can find that out. And by the way, everybody, remember that all the coverage in the New York Times and the Washington Post and I think the Wall Street Journal around COVID-19 is free. And so you can go get this data as well because they've kept that open to the public. So, Hawkeye, what do you think about, do you have to be fully protected, vaccinated to protect against the spread of the COVID virus? By the way, here it is. Fully vaccinated in the United States, 46%. At least one dose, 54%. And those 18 and over, it's 66% have had one dose and 56% have been fully vaccinated. The difference is that we've just started vaccinating kids later. And kids like Max who have been vaccinated, thank you so much, because we need even more kids to be vaccinated. Okay, Hawk.
Yeah, I mean, you're going to be protected against the variants right now. We have good evidence to suggest that. Across these variants that we've seen, with full vaccination, you will be protected. The original efficiency or effectiveness may be decreased. We saw that in that England Public Health Service for symptomatic disease against the Delta variant, maybe 88% rather than 95%. But I think just the same, you are also going to have a reduced risk of spreading any of those variants as well with full vaccination.
Yeah, and I think with that study that you mentioned, it also was talking about in the first dose vaccine, if you just got the first dose, it is reduced from that 50% with the Alpha variant to the 30%, around 30% with the Delta variant. So really the takeaway was you absolutely need to complete your series and be fully vaccinated, especially for the Delta variant and other variants like that.
Okay, so here we go with some questions from the community this morning. Isaac wants to know, is there a low demand for vaccine among teens in the metro? He saw that a Kansas City public school canceled a clinic because no one signed up. And Max, are your friends getting vaccinated?
Max, let's start with that. Are your friends getting vaccinated?
Yes, I have like 3 or 4 that are vaccinated, I'm pretty sure.
Awesome. And are you kind of going out and talking to people and trying to persuade them to get vaccinated?
A little bit, and I was trying to get my sister to do it, and then she finally did.
Well done. You know, I'm going to give you a big A+ on getting your sister vaccinated, an A+ on getting yourself vaccinated, and keep right after talking to your friends. Not, you don't want to be obnoxious about it, of course, but just show them that arm. Show them how healthy it looks, and then keep kicking the soccer ball.
It's normal.
It's normal. Awesome. And it's not stopping you from playing soccer, is it?
Nope.
You know what's going to stop you from playing soccer? COVID-19.
Oh, yeah.
That's right.
Okay, and what about teens around the metro? Do we know if the demand's up?
Yeah, I don't know. I think actually the demand's lagging, and I think that's one of our concerns, Lance, is that we're just not getting the teenagers. They think they're not going to get sick. Just remember that the mean age in Springfield dropped from 60-something down to 42. Just remember that we have a couple of 25-year-olds in our hospital who are sick. One of them's very sick, who's not been vaccinated on a heart support machine, the ECMO. And, you know, this Delta variant's going to come after you, young or old, and the original one was really much worse than older folks. And while it's still worse than older folks on the Delta variant, but it's also bad in young people. So don't get cocky. Don't think you're cool. Delta doesn't care. It can still be cruel. I just did that rap right here. I made a rhyme. I rapped, baby.
Yeah.
That was a rhyme. That was a rap.
Okay. Tanya wants to know, she said, I've heard the Delta variant can transmit in seconds. Is that true?
Well, Hawkeye or Lance, what do you think? Lance, what do you think?
I don't think it's about timing, in terms of like short duration, but it can spread more rapidly, easier, especially in those unvaccinated communities. And really that threshold is, you know, when we see communities that are lower than 30% vaccinated, and that's what's happening in those areas of Missouri, is that there's just not enough fully vaccinated people for that virus to, you know, stop.
Yeah, I don't think we really know the data on the from individual to individual transmissibility or fitness and the ability to transfer in seconds. I think it's a matter of what is that behavior that's going on. That really plays a role in it as well. What are you doing? How close are you interacting with others? Things of that nature. And I think it's more of a population determination of spread, not really from individual to individual. But, you know, again, more information is coming out about this. The virus is being investigated. All of these types of things will hopefully we'll have better data in the future.
Ashley wants to know, have we started seeing unvaccinated people getting COVID for the second time, and any better idea of how long immunity lasts in an unvaccinated person?
Yeah, we kind of took this question on a little bit earlier, but we'll hit it. So, Lance, first part, are we getting people who have already had COVID getting COVID again?
Yeah.
I'd say we've had that for a long time.
Yeah, several folks who we see since the beginning who subsequently have those reinfections.
And sometimes they're better, and sometimes they're worse the second time. So that was a big topic of controversy early on, Hawkeye, but I think it's pretty well established. One way to break that chain, get vaccinated.
Get vaccinated.
Fonda wants to know, what about children who have taken the vaccine and came down with pericarditis? And Mom and Dad, did you worry about that with Max?
Let's start with Mom and Dad on that question.
We asked a lot of our physician friends, and we just decided that the risk of COVID outweighed the risk of complications following the vaccine. We just thought he needed that protection, and we felt like we were educated enough to make that decision that that was the best and safest route for our children.
A+ to Mom, Dad, and Max on that. That is exactly the right answer and exactly true. And Hawkeye, there just aren't deaths associated with the pericarditis and myocarditis. There's some big people who got pretty sick, but in general, very mild, very self-limited, unlike COVID-19, especially the Delta variant, even in young people. Not always mild, doesn't always have a good outcome.
Sandy wants to know, do you have any idea regarding the trials, the trials regarding immune-compromised individuals, when they might be complete?
Yeah, I think those trials are going to be ongoing for quite a long time, actually, and I don't think we'll really have a clear answer probably for another 6 to 12 months. I would reference the article in the New England Journal of Medicine this week looking at immunocompromised patients, But the real question, Hawkeye or Lance, is that we can look at antibody levels, but we don't know what that translates to in terms of your immune protection. And they did a nice job. One of the editors of the New England Journal who was on this discussion is actually a transplant ID doc, I believe. And he was trying to discuss, or he was discussing, what it meant on the antibody level. We can demonstrate that there's more antibodies after a third vaccination for those who are who are transplanted. But what we don't know yet is, are they actually protected because of the other parts of your immune system? Insight, other thoughts, guys?
Yeah, no, that's a great point, Steve. In the article, the authors were quick to point that out too. We don't know the correlate necessarily of that antibody level, but just be aware there is that other arm of the immune system as well, the T cells. So I think that's a very good point. And to your first point, these investigations into immune-compromised populations, whether it's solid organ transplants or people who are on immunosuppression for rheumatologic disorders, these are all going on. And I think we'll have some early answers here coming up in the next few weeks.
Okay.
All right. Are we receiving patients that are being diverted from Springfield? And is Springfield running low on supplies in addition to personnel?
Lance, what are you hearing?
We do take referrals from areas surrounding us. I'm not sure specifically Springfield right now, but it's definitely a possibility.
Yeah, we have historically, and I don't really know. I don't know if Hawkeye, I don't know if the transfer center has taken anybody from Springfield. I think we did last week. It feels like that's right, but don't hold me to that statement. As far as PPE, I did read that they were struggling a little bit, but not like the first round. Everybody's got more PPE this time than we did the last time. The difference is this, folks, and this is what you have to be thinking about. When nobody went outside and everybody was wearing masks and people weren't driving around as much, the hospital census around the area was a little low, and people were avoiding coming in. You know, we were all off by about 15 or 20%. That is not true today. We had a CMO call this week. Everyone's census is back up higher than normal, and we're starting to see colds and things like that tip people with chronic heart failure or COPD or asthma back into the hospital again. So there's the summer colds out there. Now we're seeing them because the masks have come off, people are gathering. And so yesterday we had about 30 patients admitted in the emergency room waiting on beds. We had 800 people in beds yesterday, which is really high for June 24th. So the challenge now, and this is one of the challenges that have been in Springfield, the overall census is higher, so you don't have the same capacity to absorb the COVID-19 that you had before. And as a result, that's why people are running out of bed. So Springfield at 80 patients at Cox South, that's a lot of COVID-19 patients, not the peak. You know, the same thing would be true in Kansas City. If you gave us 80 COVID-19 patients, nowhere near our peak. But the problem is that those beds are now full because they're full of all the other stuff that had really gone away when everybody was staying at home, not doing much, wearing masks all the time. So I think the real challenge to us is capacity isn't what it was. And not as mentioned, a lot of people are out. You know, the nursing staff, the respiratory therapy staff, medical staff. You know, people are starting to take vacations because they haven't taken them for a year and a half. And so we're not staffed as well across the country.
All right, 3 quick questions and we're done. Vicki says that long haulers have been reporting improvements in their symptoms. She had a relative that said her IBS symptoms improved after getting the vaccine. Is it coincidence?
I don't think that's coincidence, guys. What do y'all think?
No.
We're seeing it too many people. We heard it yesterday, right? We heard it clearly yesterday from Chaplain Freeman as well as from Amber Stiles.
Yeah, it's great. There's a lot of anecdotes about it. I think there's only been one report that maybe a third of long haulers, and it was a very small study a couple of months ago that showed maybe a third of long haulers. We would hope it's more, but maybe only a third had some improvement in their symptoms. We're still hoping. There are still studies ongoing for better, more definitive numbers. But, you know, that is a great reason to get the vaccine if you haven't been vaccinated.
Angela says, I know a couple that has had COVID 2 times, and the last time they had the monoclonal antibody treatment. They have said that recent data shows they have good immunity, so they're not going to get the vaccine. She says every time a new article comes out about adverse side effects, they just use this to justify moreover. How do you convince this couple to get vaccinated?
I don't know that you do. You know, there are people who are just vaccine deniers. The mere fact that you've had COVID-19 twice should be proof to you that you need a vaccination. Getting COVID-19 twice does not protect you against the Delta variant necessarily, and it already demonstrates you didn't have a great immune response the first time. Well, why do you think it was that much better the second time? And the third thing is monoclonal antibodies do work, and they are effective, but they are nowhere near as effective as vaccination. So if you really want to avoid having to get just to say, monoclonal antibodies have a whole lot more side effects than vaccination does.
Yeah.
And so if you really want to be safe, just take the simple vaccine and quit fighting. And all this question about all the side effects, there aren't many side effects. Again, if you're willing to get a monoclonal antibody, why are you worried about the side effects from vaccination? Holy cow. Listen, folks, I use that monoclonal antibodies all the time in my practice. The idea that that's safer than a vaccination, that is just not true. That's the land of made-up news. Hawkeye?
Yeah, that's a great point, Steve. I totally agree with that. I'm not sure what the data is. I'd like to see exactly what they're talking about. Was it a news article or was it a research publication that they said they have an immunity? But again, the guidance is get vaccinated even if you've had COVID-19. The vaccination immunity is going to be much better than that natural immunity.
I'd pull my hair out on that one, except I don't have enough hair to pull out anymore. Okay.
All right, last question goes to Sheridan. It's for Dr. Hawkinson. She said, did you fly and did you feel safe?
No, drove from Kansas City, just driving around, Colorado. But I do feel safe when I fly. I haven't flown since early in the year. But was wearing masks, was wearing eye protection, was distancing myself as much as possible from other people in the airport. When you could. Obviously, you can't do that in a plane. But I felt safe because I was taking those precautions. Most specifically was mask and eye protection.
Yeah, I got to say, I flew in May. I felt pretty good. I wear all this stuff, take the precautions, do the right thing. Have you flown, Lance?
Nope, I haven't flown in the last year, but I've traveled, and I think just especially when you're traveling and going to gas stations and in those highly populated areas, I think just those non-pharmaceutical ways to keep yourself safe, hygiene. Don't touch your face. We haven't talked about that for a while. Just trying to reduce contact with your mucous membranes. Those are great ways for germs to get in your body.
Totally works. Hey, Monday, Dr. Jill Huded, one of our primary care physicians and geriatricians, will join us, along with Janet Carlson-Baker, the executive director of Kansas City Shepherd Center, to talk about the impact of COVID-19 on active and homebound seniors. The isolation of the pandemic has taken a significant toll on this group, who make up about 15% of the population on both sides of the state line. Hey, let's go around the horn for just a minute and ask people, oh no, wait a minute, I got something else to do first. Vaccine is the pathway out of this pandemic. We wanted to show this photo of a person who wanted to remain anonymous. She described herself as vaccine hesitant, but decided to get her shot after much consideration. Sounds like Claire, your sister, right there. She's wearing her Knowledge is Power t-shirt. Being hesitant, you know what, it is okay. Having questions is how everyone should be. It's how we make choices every day. Just make sure you're looking around to sound sources for your answers. Avoid those places. They're the made-up news network. Make sure you trust the science. And if you have a question, just go to those places where the science is being actively discussed. Go to the New England Journal of Medicine website. Go to the CDC website. Go to the World Health Organization website. Is it always right? No, because we've had to invent the airplane while we fly it, or build the airplane while we fly it. But it is better than just going to the made-up news network. And kudos to this young man who is proud to have his vaccine as well. Keegan is 13 and says he got his shot to protect his baby sister, his grandparents, his family, and his friends. Well done, Keegan. Well, Max, well done by you. Final thoughts that you'd like to tell all of our listening and viewing audience today.
Final thoughts? I just want to say that just get the vaccine if you feel comfortable with it and try to help everybody else stay safe throughout COVID.
Outstanding answer. Mom and Dad, final thoughts that you might have.
I would just say that we're both very proud of our kids. Obviously we're the parent, but making these kind of decisions, we kind of like them to feel comfortable with it. But I am proud that they both want to protect others, and and themselves through this whole thing.
Yeah, totally.
And it just gives me peace of mind to know that they're going to be protected themselves as mom.
Yes.
That's a great point, and thanks to all of you for making that choice, and thanks for being on the program today. That took a lot of courage, and Max, well done, and give your sister Claire a big hug, because it's safe to give her hugs, especially after she's vaccinated. Lance, final thoughts.
I'm with Max, getting that vaccine, and especially not forgetting about the role that kids play in this pandemic and our way out of it. So make sure that we remember that too.
Hawkeye.
Yeah, thanks to Max and his parents, talking about the youth getting vaccinated, it's going to be very important. This year, this fall, and this school year, 2021, is going to be much different than the last school year. There are going to be much more extracurricular activities going on more like normal. And if you as an individual want to care about yourself and not missing participation days and not missing games and practices, whatever that may be, whether it's sports or band or debate, whatever that is, do that. Do that for yourself and do that for your teammates as well. Because we have seen this go on. We know that vaccination is going to protect you. It's going to keep you from having to miss those participation days. It's very important. Continue to encourage that amongst yourselves, your peer groups, your friends, your teammates. Go get vaccinated.
Go get vaccinated. Those of you who have been watching this program for a while know that I love the musical Hamilton. History has its eyes on all of us. It has its eyes on you. And the choices that you make will define the course of this pandemic. Keep us all safe. Keep your community safe. Keep your loved ones safe. Keep the world safe. Keep yourself safe. Get a vaccine, and that way you're not throwing away your shot. We'll see you on Monday.